Lennox-Gastaut syndrome, often abbreviated as LGS, is a rare and severe form of epilepsy that typically begins during childhood. It presents itself with a distinct set of challenges and symptoms, making it important to understand for both medical professionals and families affected by it. First, let's define what Lennox-Gastaut syndrome is. LGS is characterized by multiple types of seizures, cognitive impairment, and a specific electroencephalogram pattern known as slow spike wave activity. The onset usually occurs between the ages of 1 and 8 years, and it can significantly affect a child's daily functioning. The seizures associated with LGS are not just one type. They include atonic seizures, tonic seizures, absence seizures, and myoclonic seizures. Atonic seizures, often referred to as drop attacks, are particularly alarming as they can cause the child to suddenly lose muscle tone and collapse, leading to injuries. Tonic seizures result in the stiffening of muscles and can last from a few seconds to minutes, while absence seizures may cause brief lapses in awareness. Myoclonic seizures involve sudden jerking movements. The variety and frequency of these seizures make LGS one of the more complex forms of epilepsy. Cognitive impairment is another hallmark of Lennox-Gastaut syndrome. Children with LGS typically experience developmental delays and may have intellectual disabilities. The severity can vary, with some children having mild delays while others may require extensive support in their daily lives. Behavioral issues, including hyperactivity, aggression, or social withdrawal, may also accompany the cognitive challenges. An essential part of diagnosing LGS involves an electroencephalogram, or EEG. The EEG in LGS often reveals a characteristic pattern of slow spike and wave discharges, particularly during sleep, but may also appear during wakefulness. This distinct pattern is crucial in differentiating LGS from other types of epilepsy and seizures. The causes of Lennox-Gastaut syndrome are often linked to brain injuries from conditions such as birth trauma, infections such as meningitis, or developmental disorders such as tuberous sclerosis. In some cases, a specific cause may not be identified. This lack of clarity emphasizes the multifaceted nature of LGS and its etiology. Treatment for LGS can be complex and typically involves a combination of medications, therapies, and sometimes surgical interventions. Anti-epileptic drugs like lamotrigine, valproate, and clobazam are commonly used, but managing LGS can be challenging, as many patients do not respond adequately to these medications. The ketogenic diet, which is a high-fat, low-carbohydrate diet, has also been shown to be effective for some children with intractable seizures. Vagus nerve stimulation and in some cases, resective surgery may be considered for patients who do not respond to medication. Supportive therapies, including occupational, physical, and speech therapy, also play a critical role in improving the quality of life for children with LGS. These therapies can help address the developmental delays and enhance communication skills, promoting better functioning in everyday life. Living with Lennox-Gastaut syndrome can be challenging, not only for the affected child but also for families. Parent and caregiver support is essential, as navigating treatment options and daily challenges can lead to physical and emotional strain. Connecting with support groups and professionals experienced in LGS can provide valuable resources and help families adapt to their circumstances. In conclusion, Lennox-Gastaut syndrome is a complex condition that requires comprehensive understanding and management. Early diagnosis and intervention are key to optimizing outcomes. By educating ourselves about LGS, we can better support those who are affected, ensuring they receive the care they need to lead fulfilling lives. Remember, if you suspect your child may be exhibiting signs of LGS or if they have already been diagnosed, consulting with a healthcare provider specializing in epilepsy is crucial for personalized care. Thank you for learning about Lennox-Gastaut syndrome today.